Right.
Good evening and welcome to members of the public to this meeting of the People Overview and Scrutiny Committee. The meeting is being held virtually in accordance with the Part 2 of the Local Authorities and Police and Crime Panel's Coronavirus Flexibility of Local Authority and Police and Crime Panels, which applies to England and Wales, and those regulations are dated 2020, and the Council's Supplementary Council Procedure Rules. In summary, the regulations are brought in as a response to the coronavirus epidemic. They remove the requirement for members to be physically present in the room. They allow us to debate, participate and vote through remote video conferencing while observing the social distancing measures needed to restrict the spread of the virus. Can I ask all members and officers to observe the following principles? Please mute your microphone and turn off your video camera at all times unless I've called upon you to speak. Remember to mute your microphone and turn off your video again when you are finished. Indicate at the start of the meeting if you wish to speak, and through the MS Teams chat channel if you wish to speak again. I will call members to speak at my discretion and according to the demand of the agenda. In terms of voting, for a small meeting, I will ask each councillor in turn. In terms of voting for a large meeting, the votes will be determined by a consensus. If there is no consensus, voting will be carried out by a roll call. Thank you. And therefore, we'll go to the agenda and I will ask Paul Conlon if he would kindly share the agenda so that members of the public can see. Thank you, Paul. Can I take apologies, please, first of all?
We have apologies from Roy Davis.
Right, Councillor Roy Davis. Any other apologies from the committee members?
Chair, can I just say that Councillor Jackie Slater and Councillor Lillian Salton are having trouble getting logged on.
Oh, right.
They've requested could Paul help in any way. I've sent them details, but that's the issue. That's why they're not with us yet.
All right. Is it your wishes that we continue and hopefully they will be able to join us fairly quickly?
Yes, please continue and they'll do their best to join us as soon as possible.
Very well. Well, item 2 takes us to the previous meeting, and that seems a very long time ago now, and those minutes are dated the 9th of March. You will remember that we did open that up to all our partners and had a meeting in the council chamber prior to our own scrutiny meeting later. The pages are numbered 2 to 5. So would somebody like to move those as a correct record?
Can move those, Chair.
I second it.
Seconded.
Sylvia, I second it.
Thank you. I think because it's such a long time ago now and things have moved on dramatically since then, I can't see perhaps any questions that members would need to raise. If that's your wishes, I would move on.
That's okay. Anything is likely to get picked up later anyway in the presentations, isn't it?
It will indeed. Right. So can we go to item 3 then? Any declarations of interest?
No declarations.
Does that apply to each member of the committee?
Yeah, no declarations.
Right. If when our other 2 members do join, we will need to just check with them. Can I ask Paul if we do have Laura with us yet, or is she still en route?
She's still en route as far as I can see. Yeah, she's still not here. So it may be pertinent to go to the next item with Jane, Julie and Joanne.
Right.
Chair.
Laura's here now.
Laura's
Right.
Laura's just arrived.
I've just
Right.
landed. I'm very sorry.
We'll just give you time to catch your breath a moment.
Thank you.
Just for the benefit of members of the public, we're now going to deal with our item 3, which is a public health progress report on COVID-19. And we do have present with us Laura Wharton, who is going to, I think, give us a full presentation on this in a moment. And we also have our exec member, Councillor Damien Talbot, with us. Right. Are you happy to go, Laura, now with your presentation?
Thanks, Sylvia. Can you see the slides now?
Yes, I think we're sharing the screen. I hope everybody can see the screen now.
I am, yeah. Paul, do you want me to share my screen now?
Yes, please, if you can, Laura.
Apologies, Paul. I'm struggling with my screen. Do you want to share them?
Is that on now?
Yeah, we can see that. Thank you, Paul.
Right.
I can't though, Paul. So can everyone else see the presentation? Because I can't see my own presentation.
Yes, I can.
Right,
It is,
okay.
Laura, and it's yours that's being shared by the look of it as well.
Right, okay. Well, I can't see it, so bear with, and we'll see how we get on. So yeah, so apologies from Dominic. He's on leave and unable to join us today. He's taking a well-deserved break. So I'll provide you with an overview. I appreciate it's a while since you've had a full update. I'm aware that the slides from the previous Health and Wellbeing Board a few weeks ago were shared with everybody in advance. So I'll give you a bit of an update in terms of where we are in terms of the figures, because they've obviously moved on considerably since that Health and Wellbeing Board pack was circulated, talk a bit about where we are in terms of the local position and additional measures, and just talk a bit about winter planning as well, because I realise that's an annual priority for this group and something of particular importance this year. So Paul, do you want to move us on to the next slide?
It's just disappeared from my screen as well.
It's very...
It says your desktop is live.
Oh.
Can I just say the script? Oh, sorry, I was trying to. This is pretty chaotic.
Go on, Damien, if you've got advice then.
I was just trying to say which slide was visible, but it's now running through all the slides, and now it's gone off.
Oh, maybe it is mine. You can see then.
I think it was.
It was.
Ah, okay, right. Well, that's good news. So can you see the second slide now entitled COVID-19 Test and Trace Service?
No, we can see Paul now.
Yeah. Yeah, got you, Paul.
We haven't got any slides, we've just got Paul.
You don't want that. Right. The easiest thing to do, Laura, would probably be to email it to me now quickly, and I can just put it on.
All right, I'll send it again. Yeah.
Chair, just whilst we're waiting,
Yes.
could I ask just a general question? It might be covered later on, and obviously it can be answered then. It's just in regard to the health progress on COVID, and it's really related to item 5. So if somebody can pick it up there, that'd be great. About children's services and education, schools and schools policies and managing COVID. I've got a question on that later on.
Well,
shall we wait
to get to that item?
Yeah,
yes.
I just thought I'd flag it up now for Jane, so she's aware that
I've sent that to you, Paul, so
Yeah, I think I've just got that. Right, that's the school one.
I think that's Jane's, yeah.
Is that one up now?
That's Jane's presentation.
I thought we were continuing with Laura's presentation.
Yeah, 2 seconds.
Right.
Paul, I think we've all sent ours to you now, in case you need to project them, if that's the right word.
Right, is that up now?
Yeah, that's up.
Gone again, Paul. We can see your screen though, so it's just getting into the right place.
Yeah, I'm getting there.
So well, just while we're waiting for Paul, the initial part of my presentation was just a couple of slides on the local outbreak management plan, and I am conscious that either some or all of the people in this meeting may have seen it before, so I suppose it was just to take a little view on whether people want to go over that again or not. I don't know who's seen it.
Is that presenting now?
It is, thank you,
Yeah,
Paul.
that's fine.
Sorry.
Okay, so do you want to move on to the next slide, Paul? Thank you.
Paul, can you show the next slide for Laura, please?
Yeah. No, I can't. I can only show that front page.
Oh,
Try again.
Laura,
Yeah.
it's Jane here. Sorry, Chair. I'm just wondering if it would be helpful if you just talked through your presentation and then it was circulated later if we're having such technical difficulties. I'm mindful of committee's time. And obviously if there's a need to ask questions, we'll make sure that this presentation is circulated with the notes of the meeting. Chair, what is that a way forward?
Yes.
So Laura, if you want to run us through your presentation, if you can see it now.
Yeah, I'm happy to do that.
Thank you.
We'll have to skip a few slides because they just
will
make very little sense without the visual, but I'll do my best to get the general thrust across to everybody.
Right.
So yeah, I'm happy to make a start, Sylvia.
Okay.
So I think just to cover off, because I think it's important, particularly for overview and scrutiny, some of the sort of the governance arrangements around the outbreak management and the wider test and trace work. So again, as I was saying, I think the majority of members of this group have now received details and have been cited on the local outbreak control plan. But I think it's really important that this group understands the content of that plan and is able to obviously scrutinise it in the appropriate way. So it's a response to the national sort of test and trace outbreak management strategy, which sets out things like the importance of rapid testing at scale, tracing to identify and alert people who are required to self-isolate, the use of data to target approaches, and comms and engagement really to help people to understand the rules and the expectations of them. And I appreciate that that's actually getting particularly complicated. So that's that sort of test, trace, contain strategy that we were all familiar with a few months ago. Those plans provide an overview of arrangements for managing outbreaks in care homes and schools, other high-risk locations and communities such as asylum seeker, refugee, houses in multiple occupation, certain businesses such as call centres which are known to be higher risk in terms of transmission. It sets out the ambition for local testing capacity, and I appreciate that testing is a very live issue for us in Blackburn with Darwen at the moment. It's challenging getting testing to everybody who needs it, but we are testing at very high rates in Blackburn with Darwin at the moment, certainly some of the highest rates in the northwest and possibly across the whole country, and that's a good thing because it's important that we do test people, find out who's symptomatic, who's positive, and break that chain of transmission. So contact tracing in complex settings, the majority of contact tracing is done via the national system, as we know. In Blackburn, cases who can't be contacted after 24 hours are referred to us for follow-up, and we are doing a good job locally of contacting those people over and above what the national system are able to do. But also complex cases in places such as care homes, schools, workplaces where there are multiple incidents get escalated to us at a local level for further follow-up. Data integration speaks for itself really in terms of the importance of collating all the various streams of data and being able to interrogate those on a daily and weekly basis to understand what it's telling us for Blackburn with Darwin. Support for vulnerable people, and that's particularly vulnerable people who are asked to isolate. So in the early days of lockdown, we saw the rapid introduction of the Blackburn with Darwin Help Hub to help people access food. That was extended to a wider range of support. Now that continues for people who are shielding, and in Blackburn we've obviously got the pilot around additional income support payments for people who are asked to isolate, and that's in its early days. And then local boards, and this is important for Scrutiny particularly to, I think, to understand where Overview and Scrutiny fits in with some of these arrangements. So as part of the outbreak planning, we were asked to establish a local outbreak engagement board, which is a member-led board. It's chaired by the leader, has a number of partners on there that meets weekly or fortnightly at the moment, and that's a really important board in terms of making sure there's political support and input into the decisions that we're making, especially when it comes down to some of these more localised decisions, and also that interface with our communities. And then also there's now a health protection board for the borough, which was something we didn't have in place before, very few areas did. And that again, it's more of an officer-based technical board which keeps a really close eye on that data and all the different strands of work, and those work strands are evolving all the time in terms of testing, tracing, outbreak management, and it really helps us just keep a hold of all those areas and hold each other to account. So all of that is underpinned by a range of setting specific outbreak plans for schools, care homes, workplaces. We've recently, and Joe might want to expand on this, and Jane set up a dedicated education resource team, which has been really, really important in supporting our schools to return to wider reopening to pupils. It's been, as Jane I'm sure will expand on, a difficult couple of weeks in terms of being able to answer all the school queries, but we have had in place support over and above a lot of areas for our schools, which has been really successful. We hold daily incident management hub meeting where we receive information about outbreaks and incidents. We've got communications and engagement in place. In Blackburn, as I said, there's a lot of additional testing capacity and testing going on, both in terms of wider offer and dedicated community testing. We've got additional local case tracing, as I referred to earlier, and obviously the enhanced local restrictions we've got in place in those 8 wards. So my next few slides are going to struggle to really give you the full benefit of them, but they're an update really on the case numbers and some of our numbers since you last received this information. So what we're seeing is our testing decreased after an initial increase over the summer period when we set up some of our mobile testing units, but in the last week or so we've really seen that pick up in terms of greater consistency around the location of our local testing sites, our mobile testing units, the proactive community testing that's going on a street by street basis in some of our wards of intervention. So that's good, and we are well regarded for the work we're doing around testing locally. Along with that, as you would expect, there's been a slight increase in positivity rates from about 4.5% to 5.8% locally. That's been fairly consistent over the last few months. In terms of positive case data, in line with the rest of the country and particularly the rest of the Northwest, we've seen a significant rise over the last week or so, and that is a particular concern nationally. And there's discussions being held with authorities across the whole of the Northwest, not just Blackburn with Darwin, in terms of what else we can do to reduce our rates. At the moment, we're at a rate of 103 cases per 100,000, which makes us roughly about 7th in the country. Bolton is the highest at the moment, and they've got nearly twice as many cases per 100,000. So there is quite a difference in that top tier, but still really concerning rates. But that list of authorities that are on the watch list has really increased in recent weeks. So what came through weekly as a one side of A4 now extends to 3 sides of A4. So we're really seeing that spread across the whole country and in areas that previously weren't subject to such high rates. So our daily case rate is now roughly about 20, and that is an increase in numbers. I'm just looking at my slides. I think one of the things that is probably of interest to this group is probably the hospital admissions. In line with the rest of the country, we're not seeing, so although we've got a rise in cases, we're not seeing a significant rise in hospital admissions, and we're not seeing a significant rise in deaths related to COVID either. That's something we need to keep a careful eye on going into winter, and there's various reasons for that. But you know, we need to think about those vulnerable groups and be aware of the impact that a rising rate across the community could have there. So just in terms of the local position, Monday evening is a difficult day to ask about the local position because we go into a rhythm of meetings with the centre, so a bronze, a silver, a gold meeting. We put recommendations forward. Over the course of today, it's become really clear that there's a step change nationally in the way things will be moved forward. The centre are less enthusiastic to go for hyper-local approaches such as the one we've got currently, and we'll be looking for putting more widespread geographically and more unified restrictions and approaches in place. So I think at this point all we can say is we probably will see a change in our restrictions this week, but we don't know exactly what it will look like, and that will be subject to discussions over the next few days. So then just in terms of winter, I think it was just to give an update really that there is that recognition that this is going to be a particularly tricky winter for all of us. Planning for winter started earlier than usual. Discussions are already well underway. In terms of health and social care, there's a lot of joint work taking place across Pennine, Lancashire. A business case has been put forward to the ICS detailing the additional resources that will be required over this winter. That includes additional capacity in domiciliary care, Home First, extended hours for assessment, additional social work capacity, and the provision of guidance and support to the wider regulated care sector. There's also, members may be aware of extensive work around a voluntary sector offer. So the Nourish group that particularly supported the Help Hub in the early days of people accessing food are now extending their offer to prepare people and support people through the winter period. So they've established a team of champions, some particular comms, and that will be to support people around messages to do with flu, COVID testing, the importance of vitamin D, fuel poverty, slips, trips and falls, good nutrition, and how you can look after yourself and protect yourself during the winter months, underpinned obviously by a wider coordinated communications campaign. And I think the final thing to reflect on really is the importance of the flu vaccination this season in terms of reducing the additional burden of respiratory illness the impact on the most vulnerable people and the impact on hospitals and healthcare in particular. Also how we protect our own workforce to ensure we've got resilience across all our organisations where we have frontline staff and key workers. Every year there's a nationally commissioned population programme. In addition, this year there are further groups, so that's household members of shielding patients and 50 to 64-year-olds, so that's reducing one of the priority age ranges. There's a very large healthcare delivery programme. I think what will be interesting this year is we will probably see rising demand for the flu vaccination. So where we've maybe struggled to engage individuals previously in the flu vaccination, I think in the wider context of COVID, people recognise its importance and are more likely to come forward. That is a good thing. However, we're also in a more challenged environment in terms of how we physically and logistically deliver those flu vaccinations in a safe way. So that is the subject of much debate, and a wide variety of additional measures have been put in. Some of our primary care networks, particularly in Darwin, are looking at really innovative ways of trying to deliver those flu vaccinations. So drive-through, for examples. We're thinking about how we better use some of our community assets in terms of community centres to support some of that. Thinking about our own workforce, how we become more proactive in encouraging people to access the flu vaccination and make it as easy as possible for everybody, and look at that real wide variety of delivery options beyond some of our usual methods it's a challenge in a normal year. This year we've got to balance it off with protecting people from the additional COVID risk as well. So I think that covers off as much as I can convey verbally from my slides. I'm happy to take questions.
Thank you, Laura. I've got a number of questions here from people, but just before we do that, in connection with the 8 wards that we named with regard to the tests and the testing rate, do you have any latest information to each of those wards as they relate to each of those wards, the ones that we were concerned about? Not the 9, the 8 that we named.
Yeah, the presentation that I'll circulate, Sylvia, has got the latest rates broken down by ward. So I think that'll be useful for everybody to see. What it does show us is that as it stands, it is still those 8 wards that have the majority of cases. Right. But the key difference between the most recent data and previous weeks is the fact that the rest of the borough is starting to catch up a bit as well. So we're now seeing wider spread transmission elsewhere. So those 8 wards are still a real priority for us. And some of those increased rates will be as a result of the additional testing that's happening there. But there is additional testing now, obviously, across the whole borough as well. So what we're seeing is an overall increase, still with particular wards higher than others. Right.
So the slides that you've submitted then, just addressing the 9 wards, that weren't involved with that. Now you're saying that you're beginning to see a change. Would we be able to have an update on that? Obviously not this evening. I appreciate you've probably not got any figures that are relevant at the minute, but would that be helpful if that was sent out to the committee members?
Yeah, in the pack we've included the information for all 18 wards. So it is there, and the wards of current intervention are highlighted in red, but the rest of the wards are in that table as well, so you're able to see the whole picture. And it's also broken down, it's separated by intervention area versus non-intervention area as well. So it's broken down in a few different ways depending on how you want to look at it.
Right, thanks. I've got a number of people who have indicated. I think Dave Smith indicated earlier on. Councillor Smith.
Thanks. I didn't indicate, but
sorry, I thought you had done.
No, but I can ask a question if you want. I will do then. Thanks, Laura, for that. Because we're testing a lot more people than other authorities, isn't it bound to be the case that we're going to get more cases? And that's the government can use that as an excuse to introduce stronger measures. Excuse might be the wrong word. But if we're testing a lot more people and we're getting obviously a lot more cases, then the government will turn around and say, oh, look at Blackburn and Darwin, but testing a lot of people is a good thing. Shouldn't they be praising us rather than putting in stronger measures? I was talking to one or two people about this earlier, and it's like we're almost being punished for testing a lot.
Yeah, and we are hearing that, and that's a concern, because obviously we want people to come forward for testing and not feel reticent because they think it's going to have broader implications. It is true that the more we test, the more we will find. Looking at our positivity rate, what you would normally see is a consistent positivity rate. Our positivity rate hasn't risen significantly, which would lead us to believe that it's not just the increased testing, it's the increased, there is increased prevalence in the community, so it's not just an artifact of the testing that leaves us where we are. I think what I can say is that government do take into account factors such as that, and we are being praised for the amount of testing that we are doing at the moment. Notwithstanding, that is also causing government a challenge, because they are having to prioritise areas such as ours, which is quite right. And there is a system capacity issue, and we are challenging that with some of our additional testing. But they do take that into account, and they do acknowledge it as a positive thing. That alone, testing rates alone and positivity rates will not be the thing alone that gets us in or out of additional measures. It is just one factor.
Okay, thank you. The next two people that have indicated a question are Councillor Ron Whittle and Councillor Damien Talbot.
Hi, Sylvia. Thanks, committee. First of all, I make a comment really, and then I've got a specific question for Laura. I think a lot of the talkers, and Dave has raised it as well, has been this. The concentration has tended to be on preventing a lockdown, but I mean, because we're sort of health scrutiny is part of our remit. I mean, obviously I'm in one of the 8 wards, which have got the most restrictions. I mean, I would have thought that from now, that as things have moved on and the number of people testing positive is going up, then I would be more concerned. I think we should shift what we're saying is to we're preventing loss of life. I mean, it's deaths that we're really worried about down the line, and I know we're not seeing the hospital admissions now. We are likely to see them, and I think I think the message now should say, yeah, we don't want a lot of further lockdown really, but we do need to prevent loss of life. So I'll throw that out to the committee, and I'm sure people will pick that up later. The other question, a specific question for Laura, is where is the from the figures that you've got, age, location, perhaps premises where it started or whatever. Are there any patterns that would help us decide or advise the government to decide if there are further measures, how that can be tailored or directed to try and prevent further outbreaks? For instance, in Bolton, a couple of weeks ago when there were figures around ours now, the feeling there was it was often through pubs, clubs and those sorts of venues, which is why they got restricted, and they still are restricted, to takeaways for pubs and things. I mean, I'm only give that as an example. I don't know whether that's the case in Blackburn. Is there an indication in the figure as to where the source of transmission, where the virus is doing its worst, so that we can target those locations or venues or whatever?
It is, and I think the difficulty is that it's household-based transmission. It's right. People socialising together, gathering for parties, celebrations. Probably an increase in transmission amongst young people as well, socially gathering. But also, it is house to house, and actually, that is more challenging to manage than if it was in specific types of of workplaces or pubs and clubs and restaurants, like you say. Our number of setting-based outbreaks is very low, and when they do happen, the numbers involved are quite small. So we have had a number of workplace outbreaks, but they've not been nowhere near the scale, you know, we've seen in some food production premises up and down the country. So we can't attribute any huge numbers to those kind of outbreaks. Our public protection team are really proactively enforcing where they do find premises where it appears that social distancing isn't being adhered to, but we are not seeing significant outbreaks that or even community-based outbreaks that we can link back to those premises. Where we find we have a number of cases in schools, there is no evidence that it is school-based transmission. You know, our schools are doing amazing work around social distancing and working with staff and students to maintain what needs to be maintained. You know, we come back to every time, this is fairly widespread community household-based transmission. Does that answer the question?
No, that's great. I mean, I mean, we should target it where it's needed and where the measures are needed, and that you answered my question.
Yeah,
Thank
to be fair, in Bolton, the evidence around pubs, it was actually fairly limited, and I think sometimes that, you know, it's more of a totemic gesture than necessarily targeting the spread. We've tried to avoid that locally.
Okay, thank you, Laura. It's Councillor Damien Talbot next.
Thanks, Chair. Yeah, it's 2 points really. One really following on from what Councillor Dave Smith said before, and in terms of the extra testing, etc., and the others about the ward data. I think Paul has emailed round the PowerPoint presentation, so hopefully members have got that, and I was having a look at that while Laura was talking. But just in terms of the entire infection rate and the wider testing, I think it is a point that's been made that we are doing more testing, and so we are getting more numbers, but it's set against a context now of nationally growing numbers. And you look at Hyndburn, there is more testing in Hyndburn now, and the numbers in Hyndburn are higher. There is more testing in Burnley now, and the numbers in Burnley are higher. The numbers in Bolton are significantly higher, and the numbers, it's quite clear across the whole country that we're heading towards another peak at some point soon. So the government's obviously got to look at different ways of managing this, and it's interesting to hear Laura talk about how the government is now not necessarily looking at hyper-local measures and maybe measures on a wider basis, because of course some of the measures that we've had over the last few weeks, where for instance gyms weren't able to open and close contact salons weren't able to open, have highlighted inconsistencies where people could go to a gym in Preston or Chorley or a swimming pool, but they couldn't go to a gym in Blackburn or Darwin and so on. And then, of course, we had the more localised measures as well. So there's just an interesting point there about where the government's going to go with this. But as Dave says, this isn't about the government punishing our area. I think the government is working with the area, but I think what we don't want is members of the public to get the wrong impression that things are going wrong in our area. What we're doing is we're identifying people. We've got the extra testing centres, we've got the door-to-door work, we've got the centre in Darwin now. It's inevitable we are going to see more people and not more cases. Just on the, and Laura will probably comment on all that, just on the ward data, again, it's interesting because there is a ward breakdown. I think it's slide number 9 on the PowerPoint. And when you look there, the wards are kind of moving up and down. And interestingly, Darwin East and West Pennine are now 8th and 9th on that list, above Wensley Fold, which is one of the intervention area wards. But when you actually look at the numbers, only a very small number of cases can propel a ward right up. So Darwin East, for instance, had 4 cases in the previous week and it's had 9, and that's propelled it right up. Mill Hill and Moorgate, for instance, we had 1 in the ward and then we've had 4 and now, so that's 49 per 100,000. So I think I said this in a different meeting, but we've got to be careful not to jump to knee-jerk reactions and say this ward, is there a big problem in this ward? We've got to look very carefully over a longer period as to where the infections are. But they are going to move around, and but I think generally it shows that the approach is right. So there were more comments really, but I don't know if Laura's got any other thoughts to that. Thanks, Chair.
Thank you.
Thanks, Damien. Yeah, Damien's absolutely right. we need to be looking at sustained rates rather than day-to-day rates, because some of those numbers are very low, and it could just be 1 or 2 households in an area that represent those numbers. And I think on the other point, we are well regarded nationally in terms of the way we've worked with governments to put measures in place, in terms of the range of things that we've done. That is now set against that rising level nationally, and you know, just to reiterate, there is that appreciation that it is very difficult to implement hyperlocal restrictions, especially when you have neighbouring authorities, and there's a lot of fatigue, I think, in terms for individuals and the public in terms of the messages and the complexity of some of those messages and the different layers of intervention. So I think it is important that our residents understand that we are, you know, we are well regarded in terms of the things that we're doing, but we are operating within a very difficult national context.
Thank you. I noticed on the screen that one of our councillors there, unfortunately, can't manage to get on. That's Councillor Jackie Slater. It is unfortunate, and Paul has responded, I do know, to send the slides and so on. I spotted Denise's hand there. Denise, was it in connection with trying to sort out Jackie Slater, or did you want to put a question?
Hi, Lillian. Yeah, no, I was just trying to sort out Lillian and Jackie Slater whilst the meeting was going on, and unfortunately neither of them are able to connect, but Paul's been helpful and he's going to get all the details to them, so thank you.
Right, we perhaps have to have a detailed look after what was causing the issues, because it was difficult to get on for some members tonight, so we'll have a look at that and make sure that we don't have these problems next time round. So we'll do that. Apologies to them. Right, any other questions for Laura?
Chair,
Yes.
I asked a question earlier about the schools.
Well,
I put it in the chat. Is it not in the...
Just a moment, unless it's specifically for Laura, I do notice on our screen that Joe Siddle is going to pick up, obviously, these issues relating to schools. Unless it's specific to Laura, if you've got something on Laura's presentation, by all means.
I haven't had a chance to look at it because I can't access both, so I'll have to leave that and send them in separately, the questions. OK, thank you.
All right, so are all members then content if I just thank Laura for that presentation? I know we've had difficulties, but nevertheless, anybody that hasn't had something answered, if you do submit those, I'm sure Laura will do her best to get back to you as soon as she's able to. So if that's the last of the questions, thank you very much, Laura, for doing that.
Thank you.
I know you've already done it to the Health and Wellbeing Board, so thank you for coming along to our committee with that. We're greatly appreciative of that. So thanks.
Thank you.
Can we move to our next item then? And that's the Children's Services. And we've got here with us, first of all, we've got Councillor Julie Gunn, who's the Executive Member for Children and Education Services. We've got Jane Ivory, who is our Director, and we've also got Joanne Siddle, who is Head of Education. Now, do you want to do this presentation next? I don't know who's going to do it. Is it Joe?
I don't know which order you want to go in, Chair, but Joe's done a presentation on for the committee on an update on education and our journey through COVID and the lockdown. And I have done a bit of an overview and an update on how we have been working in children's services with regard to the impact of COVID on our core statutory services. So
perhaps
Paul,
if we deal with the education aspect first, then,
okay,
and then do the wider thing afterwards.
And both Joe and I have done a presentation, but I'm just a bit anxious as to whether they can be projected or presented.
Oh,
so I think
right.
Paul.
Sorry, Paul, shall I try and share mine? Shall I give it a go?
Right.
The easiest way.
Right.
Is that all right with you, Jane?
Yeah, fine for you to crack on.
Okay. Oh, there we are. Oh, it disappeared now.
Yeah, I've made that disappear. Just bear with me.
All right.
Are we okay? Can everyone see that?
Yes.
Brilliant. Okay, so I'm just going to talk you through pre, during and after the full lockdown, just so you've got a full overview of what we've done with regards to education.
Right.
So the beginning of lockdown, you know, we started with the end in mind, and that was to keep our children and young people safe. That was our priority. So working with children's social care and our social workers, our children were placed into key priorities groups. So this was before the government issued any guidance to schools. We asked schools to almost rag rate children and to ensure that along with our key workers, that any vulnerable child was invited into school. So we actually expanded it beyond children with a social worker and EHCP. We expanded it to any schools, to any child whose school felt was vulnerable. And that work was put in place really quickly. So interestingly, the government issued further guidance to schools that they should include everybody who they felt vulnerable. So we asked our schools to make sure that children were risk assessed. So if they felt that a family was saying we want a child to be at home, that they risk assessed with any agencies working with that child. And if they felt that a child really did need to be in school, then agencies worked with families to ensure that that child was in school. We also put in place regular monitoring. So if a child did not attend and they were on a safeguarding plan, they were called every day by school. And we worked alongside social workers to make sure that there was contact on a daily basis with very vulnerable families. Ranging right down to all of our children have a universal offer of being contacted at least once weekly by their school. Now that might have been via telephone, or it might have been via whole school text, which is what a lot of schools use. We also had to manage the world of education within the LRF. So as you can imagine, we supported all of our schools and settings, and that didn't just include the maintained schools. We worked with our independent schools. We worked with our private providers for early years to make sure that they were fully aware of everything that was happening in the LRF regarding education. I explained to you that we had risk assessments put in place. So every vulnerable child and a child on an EHCP had a risk assessment that was done in conjunction with parents and any agencies working alongside the children and family. We also placed all of our schools in a hub. So the high schools represented the hub, and our primary schools wrapped around that hub. And for each hub, we had an independent reviewing officer that provided safeguarding support. We had a family support worker. We had a member of our SEND team. We had a member of our health and safety team. So schools had a full wraparound support for anything that they needed regarding COVID. We also ensured that our schools were regularly updated by the DFE guidance, and if we could, we broke it down for our schools so they weren't having to read through pages and pages of guidance. Early days, this guidance came out sometimes at midnight on a Sunday for implementation on a Monday, so we worked really closely with that to make sure that we supported. We were also part of the REACT programme, and Jane will probably talk a little bit more about that when she presents to you, but from an education point of view, it means that we have regular weekly meetings with the DFE and with Ofsted. We asked Ofsted to be part of those weekly meetings with us because we wanted them to be part of the journey with us. So that all happened at the beginning of lockdown. Mid-lockdown, and actually it wasn't mid-lockdown, it was 1 month into lockdown, it was April the 22nd, that we decided as a local authority we needed to work with our schools in the wider full opening. Now, a lot of local authorities might have thought, what are you doing that 1 month in for? But, you know, we wanted our children and our schools to be ready to go back to safe places once we had the go ahead for schools to open. So we did this under our school improvement board because we already had a well-established board where leaders from school improvement groups attended. We had multi-academy trusts on there, and we involved the wider stakeholders. So we involved our children's services, we involved children's social care, early help, we involved our HR services in the local authority and our health and safety reps. So we had a weekly meeting right the way throughout until the end of the summer term, and we were solely focused on getting schools back in full when it was safe to do so. We also involved our post-16 reps as well, so we also involved Blackburn College and St Mary's College in that meeting. We continued with our React meetings, our weekly meetings with the DFE and Ofsted, and they have been and continue to be really positive experiences. I think picking up on what Laura said, we are held in quite good esteem with our colleagues in the DFE and Ofsted in the work that we're doing. On top of those meetings, we also had Dfe Challenge Meetings for our SEND students, to ensure that as a local authority we were doing everything that we possibly could do to support our children and families with SEND. And again, really positive feedback from those meetings. We met weekly from the 22nd of April with our union colleagues, weekly with the diocese, and weekly with our multi-academy trust leads to make sure that they were all fully aware of everything that was happening from a school's perspective, on top of the twice weekly head teachers bulletins that all of those organisations receive. As a local authority, our health and safety team, along with our HR team, wrote a risk assessment for schools reopening. We said that all of our maintained local authority schools, including voluntary aided and voluntary controlled, because that's what the diocese asked us to do, must adhere to the risk assessments that we put in place. We offered the risk assessments to multi-academy trusts, and quite a number of the multi-academy trusts supported that and have followed our risk assessments. We also ensured that we had targeted support in place for those key vulnerable groups. So, for example, children who have got SEND, we met with our parents in partnership on a weekly basis so we could alleviate anxieties for those families and children returning. We managed the DFE data return. Again, Jane will probably pick up on this. As a local authority, we were asked for quite a lot of information from the DFE. Schools had to return their daily data return. But we also, on top of the schools return and the daily return to the DFE, we ensured that we had safeguarding in place and asked our schools to return to us on a weekly basis their vulnerable learners data and whether they were having contact with families, and I'll talk about that a little bit more, and the continuous monitoring of attendance and tracking of our students took place. You might not be able to see this in detail, but every week we shared with our schools and those stakeholders that I've just talked about the attendance of our children. So on the bottom graph, you'll see that the black line is quite low, and that was in the total number of pupils attending our schools. From the 22nd of June, when we said to schools it was safe to reopen to the wider year groups, you'll see the massive increase that we had for our children attending schools. This was our vulnerable learners data set, which we shared weekly with our schools. So we asked our schools to tell us and identify children who they felt were vulnerable. So we actually had over over 1,100 children identified as being vulnerable that schools wanted to make sure that they kept an eye on, and those children that were open to plans over 1,000 open to plans. We asked our schools to risk assess all vulnerable learners, and you can see there 89% of those children were risk assessed. 83 were risk assessed with a social worker, and 85 had the agreement of parents. Of the children that we identified as needing a school place that had been identified as vulnerable, that was 26% of our vulnerable learners. And of that 26%, we had regular attendance of about 75% of vulnerable learners. And there's also the key there that shows the amount of daily calls, twice weekly calls, and once weekly calls that were made. So we can look back and say we looked after our children. We put additional measures in place to make sure that our children were kept safe throughout. And this was we requested this from all of our schools, including independent schools. It was difficult to get the information back from all of our independent schools, but we began to get there towards the end. As restrictions lifted, we want our schools to remain outstanding. So this is the additional support that we put in for the beginning of September. Health and safety and HR reviewed those risk assessments, and as I've said, those maintained LA schools, including VA and VC schools, have continued to have their risk assessments signed off by ourselves. We also ensured that all of our school leaders, not the independent schools, but all of our school leaders received National Leader of Education support to ensure that they look closely at the school's recovery plans. So we were wanting our leaders to not only think about bringing our students back in a safe environment, but how are we going to catch up? How is that work to catch up on outstanding lessons put in place? We wanted to make sure that leaders were allowed to lead, so we ensured that we put in the education response team. The education response team is led by our Governor Services Manager and has colleagues from public health, health and safety, HR, and our risk assessment coordinator, and they give daily advice to our schools. So if a school's got a confirmed or positive case, they'll give advice. If schools want advice over their risk assessment or anything that's happening COVID related, that specialised team provide that support during the school week. We wanted to give our schools confidence in the test and trace, and we know that nationally that there are some slight issues there with that, but we wanted to give our schools confidence, especially now that they've got their own test kits, on when to give out those tests and when it would be appropriate. We continue to challenge and support the monitoring of our vulnerable groups. Our virtual head teacher is tracking our children in our care and making sure that our children who are most in need get that additional support. Our SEND pupils are tracked, and obviously our children with social workers are tracked. And we wanted to make sure that we increase parental confidence, so we would continue with our Parents in Partnership weekly meetings. We continue to ask schools to support parents. So if a parent has, for example, decided that I'm too anxious about COVID-19, I'd like to look into elective home education, to work with those parents to explain and show them what schools are doing with regards to risk assessments. And some of our schools have taken a more blended approach to those very anxious families. So first 2 weeks back, what does it look like in Blackburn with Darwin for our schools and settings? Positive thing is they are all open. And children have returned to schools and settings in B with D. The education response team is in place and is advising all our schools and settings. We have a daily meeting with the education response team, and that I attend that meeting, and on a nightly basis, key stakeholders within the local authority and our elected members are updated on closure of bubbles if we've had to close bubbles. So we were able to update that on a nightly basis. That gives us a clear overview of schools, a really coherent overview of schools and settings, and where COVID cases are being named within schools. Really positive attendance to schools and settings. We are above, slightly above national average for the percentage of children returning back to school. We are slightly above national average for those children with an EHCP attending, and slightly above national average for those children with a social worker attending schools. We continue with our DFE and Ofsted meetings, and we really see this as part of the journey, so that they fully understand everything that we've put in place. And we have been asked to give support to other local authorities regarding our journey and the work that we've put in working with multi-academy trusts, diocese, unions, and the work that we're doing with our education response team. So a really positive start to the term. Challenging, I think schools, you know, we can never underestimate that. Something Jane and I said today, our schools really are frontline at the moment. They are making those really difficult decisions about COVID cases and whether children have had contact and the number of contacts that they've had within schools and settings, and identifying, do we have to close a whole year group? Could we look at the classes that those children have attended and the contacts that those children have made contact with, and fully understanding the difference between a close and a direct contact. So it really does feel very frontline working for our schools at the moment, and they are working flat out. We're 2 weeks in, and you know, they are absolutely working flat out. What I do say is that the collaboration between all of our schools and settings, whether it's a maintained school, whether it's an independent school, whether it's part of a multi-academy trusts, we are treating through the education response team as they are Blackburn with Darwen children and young people, and we will support the schools. We make sure that all of our information goes to our independent schools. Some of the independent schools haven't necessarily returned the DFE data return, and we are working on that this week to make sure that those schools return it. It's not mandatory, but it does support us as a local authority to keep a track of where our children are and any schools that need additional support. So yeah, there's no difference if you are a school or a setting, including post-16 in Blackburn with Darwen. You currently get that education response team support to all, and it's definitely in place until October half term and hopefully until December. Thank you.
Thank you very much, Jo. Very comprehensive as usual. I'm just wondering, Jane, I know you're going to come in on another aspect later, but is there anything else you feel you wanted to add to that? To me, I feel like Jo's covered everything, but is there anything you wanted to say on those aspects?
I think, I mean, Jo has been, you know, as you say, very comprehensive in her overview, but I think it's quite important for the committee to be advised about the speed at which we have had to adjust, adapt, yes, and also advise all of our schools and settings. And actually what Jo will not say, but I can, is that how there's been a great deal of relentless hard work in order to make sure that we have stayed the right side of our relationships with the Regional Schools Commissioner and therefore the Department of Education, because working with central government, and it has been very much working with central government and Cabinet Office, has meant that there's been some very specific challenges, I think. You know, we've not touched upon the challenges for children and families and young people with regard to the way in which exam results were, you know, issued, and the change of decision. Now, I'm not making any political point. I am saying that that causes adjusting and making key changes in a very, very quick timescale has been, at times, it's been relentless. And Laura made a point earlier on about the need to, you know, that the community is getting weary. The point I would make is that the work that we've got to do now is to be able to sustain how we maintain an effective response to make sure our children stay in school. That's the overview I would give, Sylvia, for the committee.
Right, thank you very much. I know you're going to come back afterwards, but I'd like to take these questions for people who have indicated first. Well, I assume to Joe, because they indicated earlier on, and that's Councillor Denise G, and then the executive member, Councillor Julie Gunn.
Hi, thanks, Sylvia. I just wanted to go back to the telephone conversations with our young people, the vulnerable, and just have an understanding really of how you could get the information required to judge whether you felt they were safe. I've had a lot of dealings with different people throughout COVID in many different aspects. And nobody could write the textbook for this one. We were all learning as it went along. But there's never been more a time that vulnerable have been really vulnerable. And I just wondered how the team had managed and what sort of conversations they'd had to feel confident that they'd done all that they could and recognised all who were in need at that time.
Yeah. So Jill, if I pick up on schools didn't, and then if you pick up social workers, is that okay?
Yeah.
So schools identified vulnerable learners. Now, some of our schools said when the government issued the guidance around children with a social worker, a lot of our schools said, actually, it's not children with a social worker. Those children are being seen. Those children have a good overview. Those social workers have a good overview. For a lot of our schools, it was children who possibly are on the edge of a social work plan or on the edge of a child in need plan, or actually schools that they were managing the emotional health and well-being of that child well because they saw that child every single day. So we put the onus on schools to decide whether that child and that family needed a weekly or a twice weekly or a daily call. And those conversations range from schools speaking with parents and speaking to children. So even our primary schools, we had head teachers that would speak to the child and say, do you mind I have a conversation with, because I want to just catch up on how things were. If schools felt that a child who wasn't supported by a social worker or a family support worker and wasn't on any form of plan, we liaised with our family support workers to do a home visit, to just drop by and say, just calling by on behalf of X school, want to check up, is everything okay? And that happened. So new CAFs were opened up as a case of that, because obviously as time's gone on during lockdown, families have suffered furlough, families have lost jobs. So where a school felt a child was possibly on the verge of being vulnerable, may well have fell into vulnerability because of COVID. So schools, I would say, have managed that really, really well. We did see a slight increase into our CADS team as well when schools went back, and Jane will probably pick up on this. And the thing is, our schools have absolute confidence in our CAD service, because it's no longer I need to refer this in, it is conversations that's taken place. So we haven't had any, since schools have gone back, we haven't had any cases where schools have definitely contacted me and said, that we've missed this. Schools really did feel that they were having that regular contact with vulnerable learners, to the point where even some social workers had said to schools, it's okay, we're doing a regular visit to this family and we're speaking to them once a week. So rather than ringing every day, you ring them 3 days. And school leaders were saying, no, Joe Siddle said we have to ring every day, and that's what we're doing. So I had to intervene sometimes to tell schools, no, let the social worker lead on this. They know that family. I don't know whether you want to pick up on anything there, Jay, with regards to the social workers.
I don't know, Denise, does that answer your question? So, somebody, if you could go on mute. Right. What was very evident at the beginning, we said that, as Joe set out, that we would prioritise our most vulnerable children, and we wrapped our services around our schools and settings when it did become clear that the government were going to issue guidance to say that key workers' children and vulnerable children should attend school. So that meant our family support workers were linked to schools, our social workers and our IROs were working very closely, and as Jo set out, on very comprehensive risk assessments. So from the get-go, and before guidance was issued, I'd set out that we needed to prioritise initially all children in need, and then all children subject to a protection plan, and undertake those risk assessments. So we maintained our visiting of the children on our books, if you will, and we maintained face-to-face statutory visiting or socially distanced visiting. So, you know, door knocking and then stepping back. And in some cases, that did involve some of our staff being in harm's way, because at the beginning, and I'll touch on this in my presentation, at the beginning as an area, not just in Blackburn with Darwen, and it was very difficult to access the appropriate personal protective equipment. So, you know, we did have social workers continuing to do home visits, continuing to undertake that face-to-face intervention, as I say, and putting themselves at risk in the process. Fortunately, we've not had any positive tests so far. So despite all of that, we've had a number of staff tested, but we've not had any positive tests so far in our core safeguarding service.
Thank you. I've got Councillor Julie Gunn now indicated.
Thank you, Chair. Yes, thank you. I'm sorry, my battery is a bit low, so I'm hoping it'll hold out. I just wanted to make a few points, really. Jo's presented a really positive picture, and it is a positive picture. It's something we should all be very proud of. But what we also have to acknowledge is that our education department, working very closely with schools, has had to take some really challenging, decisive action, often preempting what the government actually ended up doing. And we've seen schools, and led by Jo's direction, we've seen schools having to respond at really short notice to decisions and answers to questions that, quite frankly, we've been asking for months and months. So that's something that I think we shouldn't forget about when we see such a positive response, and it is something to be proud of, and I really am, and I'll never ever stop saying how wonderful I think our education department is, working closely with schools, and how hard the schools and head teachers and staff have worked to ensure a safe return to schools for all pupils. And I think that hard work that went on, those SIG groups that were happening weekly, which I also attended, and the DFE were represented at, as Jo's already identified, I think all of that hard work paid off, showed last week, didn't it, when schools had some really positive attendance rates, and as Jo's already told us, above the national averages. So I do think there's a really positive point there, and I'm really proud of that. But we have to also acknowledge the debacle that was the exam results, and the stress and the level of stress that put on our young people who were already facing uncertainty and experiencing things that we couldn't ever have imagined they'd need to be experiencing. So to add that to the uncertainty that we're having, particularly if you were waiting for A-level results and then wondering where your future is going to be for the next few years of university education, but also for those young people in year 11 moving on to sixth form or vocational courses, etc. So I do think, whilst I am as proud as I could be of what we've done in Blackburn with Darwen, I do think we have to acknowledge that it's not been an easy ride, and we've often had to take some very difficult decisions and been held to account for them. So when government announced that all children should return to school on the 1st of June, and we took a decision in Blackburn with Darwen that we thought we needed a staggered, more delayed approach to that, so we'd have year groups going in incrementally over a period of 3 weeks. We were held to account for that, and quite rightly so. I don't mind that, but what it gave us was an opportunity for Joe to demonstrate all of the faultless decision making that led to that decision and the hard work that's been going on. So I just wanted that acknowledged. Thank you, Chair. Thank you.
I've got Councillor Smith next. Dave Smith.
Thanks, Sylvia. No, I was going to echo what Julie said. Basically, I'm amazed at the hard work and the dedication the staff have shown, all our educators and support staff. I think they've been absolutely brilliant, and it must have been really hard work and such short notice. So just a thank you, really, because I think they've done an absolutely amazing job.
Thank you. Any more questions to Joe at this stage before I bring back Jane? No more questions there. I'll bring back Jane then, because you wanted to speak on a different aspect, didn't you?
Yeah, okay. Let me see if I can you see that?
Yes, wonderful.
Right. Wow. Okay.
Now the secret is, can you get to the next page?
Oh, I can.
Oh, look at that. Yes.
Okay, then. So this is a bit of an overview of headline data on children's social care. So this is as of last week. So we have 357 children in need, 237 children on child protection plans. Now that's a rise of almost 20 children over the summer. So there's the potential that might be the beginning of a trend that I wanted to alert the committee to. And it is certainly something that is on the mind of national government and also the Association of Directors of Children's Services, as we are making some representation, because despite our best efforts, and Joe's already touched on it, as did Councillor G, that there may be children who have been vulnerable or have become more vulnerable over the period of COVID as their families have become more stressed. And as a consequence, that might mean that we continue to see a rise in the numbers of children and families requiring social work intervention. So, as I say, that rise of 20 over the summer is something that we are tracking and keeping a very close eye on. You'll also see that children in our care, our numbers are just under the 400. Now that's a small decrease, but that small decrease doesn't really reflect some of the issues that I'm going to touch on later on in the presentation. So, you know, we've been working really, really hard over the last 12 months, if not longer, actually, to manage the level of and the volume of work to ensure that social workers have the time and space to be able to do a better and more consistent quality of social work practice with all of our children, and we're having some success with that. However, you know, the drive to make sure that we are providing the right service to the right children at the right time does mean that those numbers, I would have liked to have seen them drop even further, but because of COVID and the reasons I'm going to go into a little bit later, we have seen some delays in implementation of children's care plans. Right, so Joe's already touched on this, and as have I. So our priorities over the last 6 months, so this is a very general overview for the committee, has been on our core statutory services to children in need, child protection and children in our care, and also to respond and support other children becoming who may have become vulnerable. So that isn't those, and that work around vulnerability has been very much as Joe's already indicated, working hand in hand with schools, particularly around early help and CAF. But we have to be honest and say that a number of health organisations, so our health visiting service, our school nurses, there were a number of primary health care and universal health provisions that were stopped and redirected at the beginning of the lockdown in order to sort of support the NHS response and to stop the NHS being overwhelmed. Now, as a consequence, a lot of that face-to-face, those home visiting from health visitors stopped and has only very recently resumed. And I think we all know about some of the restrictions to do with midwifery and things like that. Well, all of those very, very important health services before children reach school age, the fact that they haven't been able to deliver face-to-face up until relatively recently has, I think, potentially made some of our younger families more vulnerable. However, for those children who are of school age, we've already touched on the wrapping around of support of schools and settings during the lockdown. But the other things that we were doing as well as the risk assessments was also making sure that we took the opportunity of testing ourselves out throughout the lockdown. So we weren't just keeping up with business in these exceptional times. We were also wanting to assure ourselves of the quality of the work that we were doing. And that's through thematic audits to do with children on a child protection plan for a second and subsequent time. We looked at the impact of neglect and whether we were responding effectively to neglect. And that was the focus of our second practice week, which involved our partners and some of our schools as well alongside us, checking out the quality of our social work practice and our multidisciplinary practice as well. And then we're also in the process of reviewing and updating our departmental self-evaluation framework. So, and that's part of our Northwest sector-led peer review process. So what I'm trying to say is, despite these exceptional circumstances, we've carried on and made sure that we've been delivering on some of our core improvement priorities. So our new normal, so we've maintained our focus on the most vulnerable children and families. We've risk assessed all children who've had a social worker EHC plan and required additional support alongside our schools and settings. And risk assessments were informed by the social worker, schools and parents. So that's me just telling you the other side from what Joe's told you earlier. And the new normal as well. So as a service, our staff and workforce had challenges in the early days of lockdown. And as I've said, we couldn't access appropriate PPE, although this was resolved through the work of the council and our local Lancashire Resilience Forum. But I can't underestimate the significance of that, and as a leader here, I felt, can't tell you how responsible I felt for not being able to provide staff with what I knew they needed in order to keep them safe and families safe. And I'm just making that point because although schools have done these amazing risk assessments, they might be feeling that too. And we have some evidence that, the pressure on head teachers to make decisions about what they do next, it's far better if you can make those decisions with support and based on sound information. So, I'm very grateful that I work in Blackburn with Darwin and alongside colleagues like Laura and Professor Dominic Harrison, and also that I have the support of Joe Siddle in being able to be as dynamic and as quick out the blocks to be able to implement the guidance and translate the guidance from the Department of Education, which has often been issued very late in the week, sometimes on a Friday night or during a weekend, ready for the next week. And then, as we've already touched on, the numerous requests for data from the Department of Education and actually from central government it has at times felt relentless. And I know I've used that word a few times, but it's true. And you can't help but feel that for the schools. One of the daily returns that the schools had to complete was 41 pages long during the first phase of the lockdown, which was a daily return on the numbers of children, of vulnerable children attending, and also key workers children attending. Okay.
Thank you. Can I ask? Sorry.
Sorry. One. So we've still got more, Sylvia. I'm sorry. Very quickly.
Oh, sorry.
Right. No, we've had other challenges for placement choice for children in our care across the Northwest, particularly for some of our more complex cared for children. And we've also had delays in court hearings, which are having an impact on children's care plans and plans for permanence. And that's what I was touching on earlier. And the impact that has is that we're not able to ensure that children and their families are being, that those plans are being progressed in a timely way. And the issue for us is that if children can't be moved on safely and appropriately and in accordance with their plan, that does have an impact on our resources. So I wanted to advise the committee tonight that the budget pressures of COVID, and I know I'm not alone in this, a conservative estimate on the additional costs associated with COVID are that as a service, so this includes education and or the rest of children's services, we will have spent an additional 1.2 million by the end of the year. And our new challenges, so the challenges as we move forward over the next 6 months and through the winter, so an increase in demand for children's social care as more families become stressed, an increase in child poverty, which has already been recorded by Public Health from 40% to 60% in Blackburn with Darwen as a result of the pandemic. And that I wanted to touch on the challenges and opportunities of virtual working versus the real need to complete face-to-face work, and the fact that not all of our work should be done remotely. So it's getting back to that, getting back to more of a balance and doing that in a way which is COVID secure. And finally, from me, and again, Joe's touched on it, but the significant level of scrutiny from the Department of Education and Ofsted, because Ofsted in particular have not been able to fulfill, they've had their routine inspections suspended. So they will only start to inspect in key areas as of the end of September, and really only the full inspection regime will start up again in April next year. But they will be doing assurance visits, not only to children's services, but also to schools. And that's something, again, that we're beginning to plan for. But as Joe and Laura have set out earlier, we have had a positive response for the way in which we've managed the pandemic locally and with our partners and as a council. However, I can't thank the staff enough, and that includes all of our schools, all of the social workers, all of the other aligned professionals in the amazing work that they've done. I'm really, really proud. Thank you.
Thank you, Jane. Just before I come in, I'll ask if members want to ask any questions first. I can't see anybody that's indicated, but if I've missed you, I apologise. Do indicate if you wish to put any questions to either Joe or Jane. No? Everybody content with that? Well, can I say, first of all, I'm extremely aware of what went on because being the recipient of one of those messages that came through at 9:45 on a Friday night, and then the heads getting in touch on Saturday morning telling me that they'd called senior leadership meeting at 12 noon and so on. I know exactly how hard people were working there within the department. Not only that, anybody, I don't know how many members we've got on the committee that maybe are school governors or happen to be chairs of governors, and the length and the depth of those risk assessment documents were absolutely incredible. And I've never seen as many head teachers bulletins either. I mean, we're all used to getting regular ones, but the numbers coming through and the length of those bulletins, and the question that we kept hearing from central government, when the schools reopen, what they didn't remember that many of our schools were open throughout the Easter holiday, whether it was the vulnerable children or key workers, and an incredible amount of work going on there. And of course it was good liaison with yourselves that schools were able to function like that. So I do know personally how incredibly hard the whole department has been working. And as you say, I think also it's testament to good joined up working as well with the department, with Dominic. I've seen HR as well. I mean, the number of back-to-back meetings HR seem to be in when I need to communicate with them as well. Everybody has been really, really stretched. So, you know, we can't thank you enough for that. I've seen it personally. Perhaps some members have seen a little less, but take it from me, it's testament to all that hard work. And indeed, I think people from other authorities now asking questions and seeking help because they know how we've been upfront with things, and not just firefighting, it's preparation and anticipation of what's coming down the line, isn't it? That, you know, I think we can't thank you enough. And likewise as well, I know Dominic's not here, but how he's kept himself going throughout all this, because on top of the job, all the extra things, whether it be the media or whatever, I mean, that strain has been absolutely unbelievable. So we are fortunate in the leadership that we've got there. So on behalf of the committee, I'd like to just offer that thanks to you in the department, everybody, the people we're not seeing, do convey our appreciation to everyone. Thanks very much.
Thank you, Chair.
So I think with that, if there are no more questions, thank you. Sorry?
Yeah, sorry to interrupt you. I did put in the chat box. I wondered if I could speak, please. It's Julie.
Oh, yes. Right.
Thank you.
Indeed.
Thank you. I do apologise. My hand icon is missing from my taskbar, so I did put it in the chat. But anyway, I just wanted to say a couple of things. Firstly, like Jane has already identified, the level of support has continued throughout COVID, and all of our areas of children's services, which are vast, have continued. We've continued with this process of self-evaluation and checking and making sure that we're doing the best we possibly can. But what COVID-19 has done is expose those pre-existing inequalities, and I think it's really, really significant in terms of the point Jane's already made in terms of the demand and the increasing demand that is almost inevitable, isn't it, as schools return and as we're making more contact with young people and parents and finding out more about those children that weren't on our radar before but possibly will be. And that's to do with things like job losses and those kind of things that are outside of any local authority control, really. So I think what I'm saying is I'm pleading in a way that we collectively, because I think in Blackburn with Darwen we do a really good job of not being political about children, and I think we've got cross-party support for the interests of our children. And what I'm asking is that this committee, but also us as a wider borough, really continue to put the pressure on government to make sure that the resources that are required for this increase in demand that's almost inevitable, that we are supported with that. Jane's already told us about our figure here that's been spent on COVID-19. I'm a member of the portfolio holders and represent authorities across the Northwest, and collectively we're seeing exactly the same. It doesn't matter whether you're a Labour or a council or a Conservative control council, the cost of COVID have been exponential, and this is something that I think we really need to acknowledge, and we really need to keep pressure on across the whole of the council. I just wanted to make that point, but I do echo everything you've said, Sylvia, in terms of the level of commitment and hard work across all of our services has been outstanding, and that continuing to reflect and self-evaluate is really, really important. We know where our challenges are. We've done a lot of work to overcome some of those challenges. COVID has the potential to undo some of that in terms of Jane's already made the point about casework, for example. So we do need to make sure that we're keeping that to reassure you, the committee, that we are continuing with that level of scrutiny of our own service as well as you doing it too. So just to offer that. Thank you. And thanks for your presentation, Jane.
Okay, so I think we're all content with that then now, as far as we can go tonight. So normally one would be saying a safe journey home, but it's rather different, isn't it? So thanks for everything.
Thank you, Sylvia. Okay. Thank you.
We'll all log off.
Yes. Night all.
Okay. Thank you.
Thanks, Chair. Bye.
Bye.
Okay.
Thanks, everyone. Bye.